Roughly 28 million grade school children are now eligible to receive the COVID-19 vaccine. The CDC is recommending use of a low-dose version of Pfizer's vaccine for children between the ages of 5 and 11. An advisory panel unanimously voted in favor of using the vaccine for children in that age group on Tuesday. Officials say the benefits outweigh any risks the vaccine may pose to children. CDC Director Dr. Rochelle Walensky discussed the recommendation on CBS Mornings.
We've taken the time to get this right. So we had vaccine almost a year ago now for adults, and we have taken the time to get this right for our children. This is a child-sized dose, as noted. It was 1/3 the dose. We've done the clinical trials in children between the ages of 5 to 11. We've done the incredible due diligence to take the time to get it right.
Joining us now for more on this is Dr. Rashmi Jain. She is the concierge pediatrician and founder of babiesmd.com. Dr. Jain, thank you so much for joining us. So while many parents have been waiting for this, there are others who remain a little wary, right? So what is being done to convince those parents that it is safe to vaccinate younger children, especially when their risk from COVID-19 remains relatively low?
Yes, good afternoon, Tanya. This is just really exciting news. And you're right, parents are on the fence. A third of them seems like they just want to go get it done, get it over with, get their children vaccinated, go back to normal life. And other ones feel like this just hasn't been around long enough. I think this is an age-old kind of conversation when it comes to vaccination. Parents are always hesitant when something new comes out. Parents always want to do what's right by their child. They don't want anything to be learned years later and say, oh, I could have prevented that side effect or consequence in my child. The reality is we have to remember that nothing is going to be presented for use in the general public until it goes through rigorous studies. So we've been following this whole development over the last almost 2 years now. One, learning about the COVID virus. 2, learning about vaccine and how it's going to be produced. 3, everybody's sharing data. And such large amounts of people participating in clinical trials, more so than we often get for any other vaccines. I think the most important thing to remember for parents is we have changed what we call normal. We have changed how we live. Children aren't necessarily going out to play the way they used to. Children who have an underlying condition, an autoimmune disease, who have underlying cancer, who have underlying conditions that might make them more vulnerable to disease, have been indoors for 2 years now. So this is an amazing opportunity for us to say science and research and evidence shows that people who get vaccinated do not get severe disease, do not end up in the hospital, and do not end up dying. So we need to do what's good for the larger population, which is our children and their future, because children are still being hospitalized. They are still dying, maybe not as much as adults, but any child lost is a sad case and a sad day. So I think it's important for parents to talk to their pediatricians, for parents to understand that the number of people worldwide who are being vaccinated and the number of people in our country and Europe who are being vaccinated by the Pfizer vaccine that has now been approved for children 5 to 11 in emergency use is such a large number that we would have seen side effects if they were going to be presenting. So adults have been getting this vaccine in the large population after studies for almost a year. Adolescents have been getting it for over 6 months now. And most of the side effects that do appear will appear within the first 2 months of any type of production like this. So we are pretty confident we know what we're going to see as these children start getting vaccinated. And as another means of caution, we've reduced the dose. So by having a 1/3 dose, it's, I think, a good step in the right direction.
And Dr. Jain, how will this move forward in practical terms? Will parents be able to take their children to their pediatrician's office to get the vaccine, or how will it be distributed to children?
Yeah, that's a great question. So parents feel safest, right, at their pediatrician's office or at a location where they know people are child friendly, able to give vaccinations to children. So more than 20,000 family practice and pediatric offices across the nation are now starting to receive their shipments. So right after the CDC met last week on Friday, they started in Washington giving the go-ahead to start preparing 15 million doses that are being distributed across the nation this week as we speak. It is going to be in local pharmacies as well. So CVS, Walgreens, they're actually starting to take appointments now to start giving vaccines to the 5 to 11-year-olds as early as Saturday. Next week, I think, is the full-blown release of all these vaccines starting to get everywhere. But I think the most important thing to remember is they have made it a little easier for pediatricians' offices and family practice offices to give the vaccine. We can now store vials in our refrigerator for 10 weeks prior to opening them. They still have to be administered within 6 hours of opening, but the reality is we have a little bit more storage flexibility, which wasn't the case when the Pfizer vaccine first rolled out for adults last year. So lots of doses. And I guess the most important thing is the government has secured enough doses that if all of the children 5 to 11 years of age in our country wanted to get the 2-dose vaccines, there will be enough doses for them. So that is how the distribution is working.
That is very good news. Now, what is your advice for those 11-year-olds out there, or the parents of those 11-year-olds out there who are almost old enough to get the regular dose for adults, but not quite? Would you suggest they wait till they turn 12 or go ahead and get what they can as soon as possible?
That's a great question, and that actually came up in the American Academy of Pediatrics town hall meeting last week as well. So pediatricians in general are going to recommend get protected against disease as soon as possible, especially in this situation where disease is actually out there in our community right now. It can affect our children right now. So the answer is, if your child is 11 and they're going to be 12 in next month, we don't want you to wait. We want you to go ahead and get the vaccine as soon as it's available in your community. The other thing is let's say you start the vaccine series and 3 weeks later, your child is going to be 12. Are they going to get the same dose? Yes, the vaccine series will be completed with the same 10 microgram dose that they got for ages 5 to 11, because we've seen in the trials that the immune response is just as strong and robust with that dose. So get it now. Don't wait for your birthday. Have it done by then. Get another birthday gift.
And then can we expect that those 11, soon to be 12-year-olds may be first in line in the children's group if a booster is ever needed for this group?
Yes. So just like we've seen with boosters for the adults, we started identifying that there is some level of waning immunity, that there is a need to boost that immunity. And we are learning that those adults who are getting that third dose are actually seeing a greater amount of protection than those who only received the 2 doses of the mRNA vaccines or the 1 dose of the Johnson & Johnson. So I think it's going to be a time game. So for example, we were told if it's been more than 6 months since your first since your vaccine series, you are now in certain categories eligible to go get the booster. I think we're going to see it's going to be the same time frame after their vaccination that's going to make them eligible for boosters.
All right, Dr. Rashmi Jain, thank you so much for joining us. We appreciate your insight.
Thank you, Tanya. Take care.